I'd like to call this meeting of the Johnson County Library Board of Directors special meeting to order. First thing is citizen comments, which will be accepted in writing and made part of the meeting. And Sean, you have something to read?
Yep, I do. I have two comments. So I'm getting an echo in my own ear. So both of these comments are from Don Engelman. And I'll start with the first one that he sent at 4:37, June 2nd, and then I'll read his second comment. It says, hello, would you include the following statements for the library board meeting? The library board meeting is virtual via Zoom to reduce the spread of COVID-19. You should keep the library closed for in-person visits for the same reason through the end of June. When you do open the library again, your leadership should be there to greet and work with patrons the same way you ask your staff to. Lead by example. When you do open, please reduce capacity. When you do open, please place markers on the ground reminding us patrons to remain socially distanced. When you do open, please limit hours and provide cleaning to the facility throughout the day and keep a deep clean each night. Do not ask your librarians to do the cleaning unless you provide them with gloves and protective gear and proper training in cleaning a facility. Please review all locations and put plexiglass around desks. Please continue to quarantine with the return of materials for the next 72 hours. Consider a system that allows for appointments to enter the library when you open. One library is doing something like this. This could be done in a way that is anonymous for those concerned with giving up their identity. They could simply be issued a code if they don't want to use their names. Please provide time off for library employees that test COVID positive or positive for COVID-19. And please provide hazard pay for library employees similar to what the grocery stores have done. So that's the first email that he sent. And then the second email is, if you would please also add this comment. I've reviewed the briefing sheet reopening Johnson County Library buildings to the public from the county librarian posted in the meeting packet. I feel the recommendation currently does not have enough facts, including branch hours, staff rotation options, numbers of staff available, as previous board meetings mentioned furloughed staff. To approve the proposal at this time, I ask the board to look at and approve the county librarian's alternative option to implement a curbside hold and pickup at all locations on June 15th. This will allow the county librarian time to provide more facts and make a detailed proposal to the board at the next board meeting while still providing services to patrons at all locations. And then basically we got, there's a kind of reply back to Mr. Engelman, thanking him and assuring him that we are going to go ahead and read his comments at this board meeting. I just wanted to let the board know that this meeting is being broadcast on the internet via Zoom and Facebook Live, so it's streaming Facebook Live also. Also, because this is a little unusual, what I would recommend for every board person is we're going to have a presentation on the reopening given by Jen and Nancy, that you state your name and then your role, and then pose your question to whoever you think, whoever you would like to answer it, and this will provide clarity as we're trying to do things both in person and remote and digitally. So are there any questions at this stage as we go forward? Okay, so I'm not sure how everyone's technology is working at this point, but we have the screens behind us. If Jen and Nancy, if you'd be prepared to go ahead and start your presentation on reopening and where we're at today, and then it will be followed by my recommendation on the briefing sheet, and then board discussion going forward.
Good afternoon, everyone. This is Jennifer Munkin. I'm the Associate Director for Branch Services, and with me is Nancy Birmingham. She is an Assistant Branch Manager in the organization at our Leawood branch. She is the Project Manager for this group, the reopening team, and she and our team has put together this presentation on what's been going on, where we're at, and where we'd like to be, and hopefully that'll give you a little bit of background as we bring forward our recommendations. So I'm going to turn it over to Nancy, and then we'll take your questions. Thank you.
Good afternoon. Again, my name is Nancy Birmingham. Normally, I am the Assistant Branch Manager for the Leawood Pioneer Branch. I am currently serving as the Project Manager for the reopening project for Johnson County Libraries. Michaela, I believe I'm supposed to tell you when we switch slides. Some of the considerations that our group took into account were obviously the public health guidelines, the ability to meet state and county social distancing protocols, availability of staff, the availability of personal protective equipment. You'll see PPE a lot for staff. This includes face coverings, gloves for certain tasks, and hand sanitizers. The ability to sanitize and clean the library facilities themselves, as well as signage for both public and staff, and training for staff. Next slide. The library itself has never been closed during this time. We have been offering virtual services. Those are including online programming, email reference sources, ebooks and e-audiobooks have seen great usage. We have streaming video services. Among them are Canopy, Acorn TV, and more. We have downloadable magazines and newspapers and online learning opportunities. So those are just a snapshot of some of our offerings during this virtual phase. We were prepared for the phased public library reopening. All libraries were cleaned and sanitized. We are adding signage and safe service points. They are in place. Library staff are permitted to work on rotation so that everyone is not in our buildings at the same time. Book drops are open currently at 3 buildings. They were opened 1 week prior to the drive-through service being offered. So next slide. The phases that the reopening team is working with. Phase 1, the drive-through holds pickup with staff access to the libraries. That is the phase we are currently in, and you have seen on the news and some other places. Phase 2 will be the library open to the public with modified in-person service, so not quite everything we had offered before. With phase 3, always the goal, the library open to the public with full service. So next slide. Some of the triggers for phase 1, which began on May 1st, based on recommendations from the county and state public health departments. The stay-at-home orders were lifted or eased. Reopening preparations were complete. The staff being available for library work. Some of the considerations with this are caregiver concerns, childcare concerns, and the staff's health. Cleaning supplies available were one of our triggers. We wanted to make sure we had completed risk assessments. I believe the link to this is in your board packet. If not, we can certainly get to it later. On mitigation and strategies adopted. Next slide. I won't get into too many details here, but risk scores were given for many of our services, and services were modified depending on what was the least amount of risk to the public and the staff. Next slide. Phase 1 is again what we are currently in, which is drive-through holds pickup with staff having access to the libraries. That means The drive-thrus are open at Blue Valley, Monticello, and Lenexa for holds pickup only. Some of the services offered is drive-thru holds and material return, meaning dropping off your items, at those 3 branches. There's regular scheduled cleaning at each branch. There is hand washing with great regularity, the ability to take the staff's temperature as they arrive for work. We have practiced social distancing, the stations themselves 6 feet apart, always with an eye to safety. Staff is generally scheduled from 8:15 to 5:15, though there is actually a little bit more spread since these slides have developed to spread out our staff even more. We rotate telework and working at the library as necessary. We mostly at the libraries are currently processing material returns. Returned items are being kept in quarantine for 72 hours at various locations in the building. Manual discharging, this is put in simply to state that some of our processes are a little bit slower as we take care with these items. Items are processed and shelved prior to and at the end of the day. So that's how the staff hours are being a little more spread out. The drive-thru pickup, again, just the 3 buildings that already had drive-thrus, and some additional operations that are continuing are the virtual chat, the email, the phone, the reference, all of those items that were listed in the virtual phase. We have actually expanded our virtual programming and continue to do so. We have returned to collecting our mail and our incoming items and resumed our technical services department. That's mostly back of the house services. Just one quick slide to let you know what 72 hours of quarantine might look like. Next slide, Michaela. This is 1 day's worth of returns at each of the 3 branches. We actually included a staff person so you could have some idea of the amount of materials that our patrons return daily. Okay, next slide. That's where we are. This slide is for where we're going. Triggers for phase 2. Again, this is actually having patrons in the buildings. The stay-at-home order has been lifted. The staff available for library work. Other non-essential businesses reopen with precautions. We are not only looking inside the library, we're looking at other business models. Cleaning supplies available and adequately stocked. Again, the same risk assessment tool is used to measure our services, which you'll see in the next slide. We have examined each of our services as offered and mitigate where possible so that we can offer a safe service for our staff and our patrons. Next slide. Again, phase 2, the library open to the public with modified service. Our service hours are simply listed as to be determined in this document. Those have not been finalized yet. The hold shelves will be open with self-checkout at all branches. Material returns will be available at each branch. The collection browsing will be available. There will be limited computer use. The makerspace is not slated to be open to the public in phase 2 at this time. Informational services is still mostly virtual, and we're still working on bookstore hours because, again, these hours are to be determined. There will remain safety concerns, regularly scheduled cleaning at the library, regular and repeated hand washing, the ability to take temperatures at each building. We'll be practicing social distancing, both amongst staff and with the patrons. There will be sneeze guards in place. That's what we're calling those plastic shields at our service desk. The public is recommended to wear face coverings, and signage and announcements for social distancing will be prevalent in our buildings. The staff schedules are still to be determined, but we will remain rotating telework and library work. Online meetings only amongst staff, virtual account help and reference services available, and shelving in the buildings. Our materials handling, which is the actual checking in and out of the items, will be automated if possible. Otherwise, it will remain in a 72-hour quarantine situation on a running 72 hours. The drive-through holds pickups will again remain operational at the 3 buildings, and in-person pickup, as always, can be made at the libraries with a no-contact situation with our self-checkouts. Additional operations, we will be continuing with our virtual chat, email, and phone reference, plus some of our virtual programs. The shipments continue back of the house, and there will be a limited seating available at the library. That is going to be our recommendation for phase 2. Next slide, please. Again, the goal has always been that phase 3. Based on county updates on safety to resume services, when social distancing is no longer required, or we could still have some limited recommendations, and either a vaccine is available or herd immunity has been achieved. To let you know, reminder of what that phase 3 will look like. Michaela, next slide. That is the library open to the public with no limits, with our regular open hours, with full service, all programs restored, our meeting rooms back in service. Regularly scheduled cleaning will continue to occur. It always has, and we're going to make sure everybody knows that we're going to keep that up. The staff will return to their regular schedules. We will once again make full use of our automated servers or automated materials handling sorters. The computer and some virtual programs will remain. We would like to take this time to keep what has worked and really expand upon it, when we will return to 100% of our available seating. Any questions?
If I may, this is Jennifer, if I may expand for just on a couple things real quick, and then we'll gladly take all of your questions. I wanted to talk to you a little bit about what our services will look like the first week, to what we know today anyway. We are hoping to have about half of our computers available. That is based on trying to maintain that 6 feet social distance. And some of our computers are very close together, all compacted in one area of the library. And so we'll probably have about 50% capacity of our computers available. We will be limiting staff interactions with the public. We will ask for social distancing and for them to abide by that when they interact with staff. And we'll be trying to limit the types of interactions. So we're using a 0 to 5 minute rule. If it's longer than that, we're gonna try to curtail that so that we are abiding by that duration criteria that's been in place. So it means we will not be able to help patrons with long, in-depth questions on the computer or long reference transactions. We'll be trying to encourage those in a virtual setting instead. I think those are the big things. I do want to reiterate seating. We will not have very much seating available in the libraries, again, to encourage patrons to get the materials and not linger too long in the library. We will be, well, I'll leave it at that. What questions can we answer for you?
Anybody have any questions?
Well, I would say my first question is, how do you know when herd immunity is achieved?
Wayne, I don't think you're off mute. Oh.
I'm sorry, I couldn't hear his question.
So his question was, how do you know when the population has herd immunity? From what my understanding is that you have to have 60% of the population actually have be infected with the disease before herd immunity is accomplished. So if the US is sitting around, what, 350, 355 million people, you're looking at roughly maybe close to 200 million people of catching COVID, roughly, and for that herd immunity to be in action.
And we're relying heavily on some CDC information.
So Dr. Burke's question was, who are we depending on to get this information? So there are kind of three ways that we're looking at that. One of them is we're looking at both the local Department of Health and Environment within Johnson County, and then Dr. Labasta's. And then the next issue with Dr. Areola, the next issue is that we're looking at the state of Kansas, their statement on this, and then we're looking at the CDC and Johns Hopkins but the CDC is the primary as far as expert knowledge. How are we doing this? You're right that I think at this point only 3% of Johnson County residents have been tested. We have close to 603,000 people in the county. I think last time I looked, it was 8,000 to 10,000 people had been tested. The way what they're doing, and Dr. Areola is doing it, from my understanding, is they're taking sample population statistics and then extrapolating from that. So we can't probably test everyone at a 1-to-1 ratio. The more testing we do, the more we're able to do a predictive of when we get herd immunity within the state or within the Kansas City region. From my last count, what we looked at in the states was 1.8, which is known cases, 1.8 million. But there is going to come a time where we either get to the herd immunity or we get to a vaccine. So that's how I think as I understand it, the experts are calculating that.
I guess my concern, can you hear me now?
Yeah, I can hear you now.
A little technical difficulty, operator error is what it was. I guess my concern is we can move out of all the phases, but if we're following this as a recommendation or a requirement, we could be stuck long into not opening when everybody else around us is open. That's my only concern.
I think phase 2 proposes that we open our buildings, and so the recommendation here that I'm going to make is that all staff return to work by June 8th and that we open all of our facilities by June 15th. But there are going to be certain things that we are not going to provide just as immediate. And so we may do what the governor does and come out with a phase 2.5, which may open meeting rooms and maker space. But at 2, what we're doing is basically opening up the building so people can come and get access to computers and get access to material. But we're encouraging them not to linger. And so we'll be making limited seating and tables available for people until we progress, and then we'll be loosening those up. If we continue to see Kansas and Johnson County in particular in a downward trend, which we continue to do as case goes, then we're going to be able to see that we can loosen these restrictions and provide more seating, open the meeting rooms, and begin to start doing programming. But if we see it on the uptick, then we're going to have to then restrict further.
Okay.
Bethany Griffith, can you guys hear me?
Yes.
Okay. How long are we going to keep materials in quarantine?
We're going to keep materials in quarantine, and again, talking with library systems across the country, it seems it's become a standard for 72 hours until we get definitive data. So there is not a library that I'm aware of in the country that is taking in material, discharging it, and immediately putting it back on the shelf. So there's a best practice until we get results from the Bartell OCLC, IMLS, the Institute for Museum and Library Studies, and the Columbus Library on how long the actual virus lives on the exterior of books. Even the CDC does not have that data available, though they say it's harder to catch the material or catch the virus off material. They don't say that it's impossible.
And what kind of tax is that putting on staff and services getting materials out? I mean, if it's everything 72 hours, then how long are patrons going to have to live with our system being incredibly slow?
Right.
Because I understand that we're trying to mitigate risk, but what I want to know is what kind of appetite do we have for precaution to turn into lag across our system?
Yep.
Right. It is incredibly slow, this process, and we've lost many efficiencies by having to do this. So we're hoping that the results are due in a couple of weeks, and we're really hoping that they show we can stop quarantining.
Okay, and so this seems to me that on a board level here, that what is our appetite here? I mean, if the CDC is saying it seems really, really hard, and what the science is saying is that, well, technically, yeah, there are like 3 specimens, 3 cells are alive on the cardboard after a couple of days, but so far, nothing seems to indicate that stuff is sticking on cardboard. I've picked up groceries. I picked up stuff at stores. I've had pizza delivered. We've done all kinds of stuff for the last 2 months, and nobody at my house has been sick. So how long do we wait with our system in lag before we realize that in this case, this precaution isn't really serving us?
I mean, I'll speak.
I'm sorry.
Can you hear me?
Yep.
No, I mean, I agree. At 72 hours seems excessive, but I'd rather wait till a study's done. And if they come out and say 72 hours is excessive, then if they're doing these studies,
Yep,
then I'm okay with waiting, especially if he said there's going to be 1 in 2 weeks coming out approximately.
Yeah, it's, to be honest, the study was meant to be completed by mid-May and hasn't, so there's been a delay on it. I guess what I'll qualify it as, we're hoping that the study comes out in the next 2 weeks. That's what we've been told. But it wouldn't surprise me if it wasn't till the end of June. And you as the board have the ability to go ahead and give instructions to me to drop the quarantine and no longer quarantine the material. We can go ahead and do that.
My only, can you hear me?
Yep.
Okay. My only concern with, I personally, like Bethany says, I'm not worried about it for myself, but I know other people are. And so my concern would be if patrons knew we were no longer quarantining and they were worried, what materials might they try to use on the books to clean them, damaging our property?
Yeah, again, with the grocery stores, there's been videos of like when you take your groceries of, instructions on how to clean those surfaces. The analogy between a grocery store and a library is a little different because the material lives in the home and then is returned. And so that's the other piece where you tend to not do that with your groceries. But Bethany's point is really valid. The Postal Service, the UPS, there isn't any kind of showing that these types of delivery systems to your house. We looked at some of the pizza delivery, some of it's promoting it touchless, and whether that's actually mitigating or modifying risk, or is whether it's promotional. I think what the feeling is, we just don't know. The CDC doesn't know, and so we don't have any science on it. So what we're doing is following best practices with the data that we have available, and that seems to be consensus across the country with public libraries to quarantine for 72 hours. But again, the board has a couple of decisions. it has the decision on the recommendation to make after the discussion, and then following that, if the board chooses, we can also get into the quarantine, and that will give us a direction to go forward.
I mean, we got to have some confidence because people are going to be, I don't know anybody that just picks out a book and that's the only book they've touched. You know,
Right.
you know, everybody goes through a book and you pull one out and you look at the cover. And so hopefully we've got some level of confidence that.
Well, not only that, but how many people touch different apples and put them back?
Right.
Or cans of peas or any number of things. And so I understand wanting to be sensible and wanting to be aware of patron concerns, but there comes a point where I don't know how long our system can be held hostage to a precautionary principle that errs that much on the side of caution. It's like, I'm all for being cautious, I'm all for being reasonable, but there comes a point where we descend into parity. And I'm concerned that if we keep up with that, that we're going to start getting more and more blowback from our patrons, that it taking a really long time to get your materials in a drive-through, that it takes a really long time to drop off your books, that stuff isn't available. I want to avoid that. And so we're moving in the right direction with getting to be open on the 15th and to do it cautiously, to make sure that we have systems in place to make sure that we're sensible. But I don't want us to get stuck in a rut of over caution when it's really no longer warranted. We know more than we did in March. And so I want to make sure we're doing that.
Jennifer, did you say about how much it's taxing our system? Does it make a difference if we go to 48 hours or 24? Does it improve
No.
that
It doesn't
considerably?
make any difference. If you, as long as we're quarantining for any length of time, it slows down the process. Because we're not able to use our automated processes that we have in place. So all the things that we had done to automate things, we're having to stop right now.
And why is that? Is it how the bins are used, how things are sorted, that could we have things sorted and then have them quarantined? Where is it that the drag is being created by this caution?
Yeah, so
where in the process?
Yeah, so that I can talk a little about this. So the process is when the material is returned to us, then it goes into a quarantine status before it's discharged, where before it would just automatically be discharged. And so if you think about Monticello and Lenexa, so that's completely automated, as it is here in Central. When you're in the building, it goes onto a conveyor and is then done a rough sort. What we're doing is then taking those bins of return material and then putting them in location. If you think that we're circling about close to 22,000 items in a day, and that's kind of what's coming back in, the delay is to finding locations for those books. In a week, it's going to be 100,000 items, but in 3 days and 72 hours, it's probably close to 60 to 70,000 items. And it's just the volume that those have to get put down, stored, dated, kind of quarantined for that period of time. Then they have to be picked up and then put onto the sorting system, sorted, and then returned back to the shelves or trapped for our patron hold. And so really what we're adding is that process. Now in reflection from discharge to shelf, we were, compared to other libraries, exceedingly fast and exceedingly low cost because of the RFID and automation. A 3-day delay from when a book's returned to when it goes back to the shelf may not necessarily be unusual in other systems, but it is very unusual for us, which is when it's discharged, it's returned to the shelf the same day. And so we're tacking on 3 days with that. But again, those are the pieces, and I think we're going to need to make a decision on that, or at least propose a decision for the board and to get clear direction from you today. Are there other questions that you have for Nancy or Jennifer on the reopening, or questions for me?
Can you tell us the dates again that you were, I understand things change.
Yep.
But in a perfect world, nothing changes. When were you going to propose going to phase 2, and when were you planning on to go into phase 3?
It's a good question. So phase 2 would start June 15th, right? So all staff would come back or be asked to come back by June 8th. And then June 15th, all locations would be open. And then we're going to probably take a look at that at every 2 weeks on where are we at, where's the virus at, and make an assessment. Do we go to phase 3, the final phase? And so there's going to be, like just they did with the state, and they move through the phases every 2 weeks. We'll be looking every 2 weeks at that and going, are we ready to move? Have we met all the criteria to go to phase 3, open up all the meeting rooms, really not do social distancing, all those types of other criteria that we might have, open up the meeting rooms and really be back to pre-COVID operations. And there may be a space between 2 and 3 that we look at where we turn the spigot and open some meeting rooms and provide social distancing within those and those types of things. Cleaning materials.
Sean, we actually have probably 5 phases under the start of phase 2 to slowly start to reintegrate services over the rest of the summer, the rest of the year.
Okay. Does that help?
Yeah, question. So how do we monitor the amount of people in a building, or is it just going to be, do we have a certain number we don't want to exceed in each library? Is it just an eyeball test? And
we're not monitoring, because when we open, we will be in what would have been the governor's phase, where she didn't have any limits on it. And so the Board of County Commissioners we're not limiting the number of people. Maybe we'll take a step back. So 2 weeks ago, kind of on Monday evening, the governor came out and they were partway through the Ad Astra plan for reopening Kansas. And at that point, the governor stopped that program and then kind of came back to an issued a statement saying that the Ad Astra was no longer in effect for reopening, and it was the responsibility of each county to determine what measures they wanted to place in order to deal with the COVID-19. Our Board of County Commissioners then talked about that, and you can go back and look at the video, and basically they came out with the set of expectations and moved straight away to stage 3 of the Ad Astra plan, and then within 2 weeks would go to stage 4. Stage 4 places no limits on groups. You can have concerts, you can do all that. We will be in what the county's stage 4 when we open on the 15th, and that means that there'll be no limits on the people that we would have in a building. And the way we keep track of how many people in the building is with the door count. It's one way that we do it, just for statistics, to see how many people are coming into the organization. But there's no, in this recommendation, there's no recommendation to do any form of metering as people limiting the numbers of people, making appointments. There's no requirement that we can do for people to wear face masks. We can suggest it as a recommendation, and then there's no expectation of it's kind of that there'll be added protections above and beyond what we've laid out for the public. So if the public, what we're asking them to do is social distance with staff, but if they wanted to gather around a computer or do that, then that's not something that we would, as an institute, break up. That really is the patrons or the public's decision to do that. Are there other questions or concerns?
Can I add something about the quarantine?
Absolutely, Nancy.
We took that into consideration, which is why the book drops themselves to the drop-off procedure started a week before the loaning procedure, so that we could actually keep up and we are keeping up. We have an amazing staff. So the process is a little slower. It's got more steps, but those items dropped off are being processed on a daily basis.
Bethany Griffith, Sean, are we on track to have the entirety of our staff back for the 8th? Is HR still a lag, or has that kink been ironed out?
Yeah, that kink has been ironed out. So I want to talk a little about that, which is only 75% of the staff are returning, 25 is not. And so next week at our board meeting, I'll be proposing to you, and we can talk about this today because it's concerned with reopening. With only 75%, what I'm proposing is that we open at 60% of our hours. So we'll be open reduced hours because we don't have staff. We then will go forward, and I've already talked with county HR, saying all those that are choosing not to return, we've got a hiring freeze because of counties issued one, that we would ask for exceptions for those positions. We have the budget to pay for them, and that we would start going in, through the hiring process. So why open only 60% of the hours when 75% of staff are returning? Well, staff still, of that 75, still get sick and still take vacation. And so what we're seeing is that normally in any time during the year, we have 12% of our staff that are either sick or on vacation. So 88% of the population is active. We're also thinking, well, what's that other 3% for? And when we calculate it out, that's for the COVID leave that people are able to take. So staff are able to take sick time to care for someone or themselves. They're able to take vacation time. They're able to take FLMA leave, and then they're able to take the COVID leave that the staff, that the county has provided. And so, with that being said, we're predicting that staff will take advantage of that, take advantage of those benefits, and are saying that we will be able to open at 60% capacity. That's how we got to that number. And it's my knowledge, and Jen, you can correct me, but I believe that almost all of those calls have been made. It was the goal to have been bringing those staff back that all those calls would be made by the end of Friday, end of tomorrow. So if you voted on this, we would be in a very good position. It's accelerated for us. We were originally looking at the governor's plan and originally had kind of timed this out for June 29th for 3 locations to open preliminary, and then after July 4th at all locations, meaning that we would be in sync with the state and the county as they're reopening. But with the governor putting aside their plan, Kansas plan, and pushing it to the states, the BOCC has accelerated that 2 weeks forward, and then what we've done is accelerate that 2 weeks forward in order to match.
Sean, what hours do you think they'll be open? You said limited hours?
Yeah, Jen, do you have the hours at the top of your head? I don't. Okay.
Yes, so
okay.
Just to confirm, all the calls have been made, all staff have been invited back, and many staff have said they can't come back. And then there's also staff who were not furloughed that are very nervous about this, and so are saying, I don't want to serve the public and are seeking leave. So that's kind of what we're dealing with as far as the staffing is concerned. The hours we're looking at would include two nights. So Tuesday and Thursday evenings, 12 to 8, Monday, Wednesday, 9 to 5, Saturday, 9 to 5, and then all the branches that are open on Sundays would be open 1 to 5. We're proposing no hours on Friday, just to try to get to that 65% level. So if we add those Friday hours back in, then that gets us over that level. So we're really just trying to maintain that balance of serving the public to the best of our ability, maintaining our online programming, and keeping up with materials handling with the staff that we have.
Yeah, it's going to be.
Oh, sorry. I just wanted to know what the next steps were going to be after.
So the next step is to get the exception from the county manager. She will, Penny Post Oak Ferguson will either grant that or it will be denied. If it's granted, which I believe it will be, then our priority will be to get those staff hired and then expand it back to normal hours, and we will be expediting that. But it is generally where we're seeing it is in pages and clerks, and pages and clerks are the ones that are ultimately tasked with returning the material to the shelf. They tend to be part-time positions, so 16 to 20 hours.
When are we planning on asking our volunteers to come back to reshelve? Because I know that that's one way that the friends and stuff have been contributing is with reshelving. Is there an opportunity to see if there are volunteers who are willing to come back to help expedite that once we are towards business as usual as we ease in towards the end of June?
Yeah, so Amber, our volunteer coordinator, is going ahead and asking. Of course, our volunteers tend to be older, and so we're getting some that want to come back and then some that are nervous. The Friends have already started bringing their volunteers back with social distancing, and we would be doing that. And so what we're trying to do is limit the number of staff in the building to protect the staff, but also trying to achieve the mission, which is to get those back. So it's in progress, asking our volunteers to come back. That's already been started, but we may, just as with staff, we're thinking we'll probably get maybe close to 50% if we were to calculate that out today, and 50% saying they want to return and 50% saying they don't. So our capacity will be reduced again.
Is there a possibility of having volunteers in when we're at reduced hours so that if we're going to be closed on Fridays for a little bit, then we have volunteers and then to move materials if there's a concern about mass contact, if that's somewhere that people are concerned, is that you could social distance a little better on a building on a Friday when it isn't open to the public, and then we're still getting, if that's a bulk day to process material, if we're still being slow.
I think
Exactly, Bethany.
Yeah. So that's been talked about. It's been talked about with our pages and our clerks, because we're going to extend hours so that they can do the shelving when the public's not here, if that's what they choose. Even with that accommodation, we're seeing volunteers and staff unwilling to return back into this environment. So I think for many people, particularly volunteers, that stay-at-home order is still very much in existence for them, and they're managing their social interactions going out. So yes, that's something that's part of the plan. We're offering it as an option, and for those that want it, that will be there to be able to come in and shelve before, just come and shelve after we're closed.
The one thing I want to, am I on? The one thing I want to say is I am so excited. I can tell you, as small as my community is, they are ready for their library to be back open. I mean, this is for a lot of small towns, the library is a focal point, and they're ready to get their hands on. I did want to say that I went by, and I'm going to say it wrong, Indian Springs? Indian Creek.
Yep.
On Saturday. Phenomenal experience. I actually have books in my hand again, so very appreciative. Do we need to make a motion for an action item? I mean, do we want to keep discussion? But I think if we can get the staff back and we can do it safely, I would like to see us move forward.
Yep, so to answer your question, yes, we are needing an official act, by official motion and a vote on this, and then we can get, after that's done, we can go and talk about the quarantine, and if you make a motion on that also.
Before we have a motion, I did have one other question on the HR situation. For the people who are choosing to not come back, from what I understand with the furlough and stuff is that if you choose to not come back when you've been asked to come back, that you then lose the extra money and stuff from the state and from the federal government. Is that something that we have to do anything, or is that kind of automatic? That is there a paperwork thing that if people are saying, I don't want to come back because I'm not comfortable because of whatever reason they choose to not come back, then are you talking that they're separating themselves from the organization, that basically they get called, say, we'd like you to come back, and they say no, that is basically, I'm quitting because I want to do something else?
Yeah, so that's again is a really good question. So on the most extreme, a staff person could be asked to come back and then they choose to separate or just not communicate any issues. So that's one, and then that all is the board. The library board has no responsibility. All those are then taken by HR because it's a termination. And we, as an organization operation, would go ahead and take care of all the issues, badges, computer access, all of those types of things. As far as repaying unemployment or any of the other federal programs, that's between them, HR, and the entities. And you as a board need, there's no need for you to take any action on that. On the other ones, again, a person can refuse to come back, but also ask for FLMA. If FLMA is something that you provide paperwork, county HR reviews, and then will either grant you FLMA or won't. That generally is for a rolling 12-week period, which just secures your job, doesn't necessarily provide you with salary or any other benefits, but preserves your benefits just like you did with the furloughed staff for health, dental, and vision. Then the next issue is someone says, I'm not coming back because they choose to take sick time. So they still stay as an employee and they get to use their sick time. After 3 days, they're required to provide a doctor's note by policy to their manager, which is then also provided to HR. Then they can continue to take that sick time. And the same with vacation time. If a person has accrued vacation time, then they could choose that as an option. Then the kind of also the COVID leave that the county has extended, while still being gainfully employed, those are there are options that are available for the employee that would prohibit them from coming back, but not open up the position for us to post.
One last question on temperature check. So we are not requiring it, but are you recommending it for the employees? Or how's that?
No, we cannot recommend it. What we can do, we've done two things. We provided the no-touch thermometers, and 2 of those at each location with oximeters also. And there's oximeters if you're asymptomatic or if you're not having symptoms, but you have low oxygen level is another indicator that you might go and seek that. We're just providing those to staff, letting them know, but we're not recommending that they take their temperature. Neither are we recommending that they take the oximeter. What we're saying is these are available if you choose. And again, same with staff wearing masks. We can recommend that staff wear masks, but we cannot mandate it. I think, Joe, so Joe Waters has texted me that he has a comment. If you're on the line, Joe, did you have any comment that you wanted to make on this? This is Joe Waters, the assistant county director.
Sean, yes.
Yep.
Thank you. I will get to the item that I texted you about in 1 second, but you did a remarkably good job, apparently off the top of your head, on the variety of options that could happen as we begin to call employees back. So I commend you on that. What I was suggesting is that in my text to you is that the Board of County Commissioners did indeed take action to put a Johnson County plan in place that the date of where began last, pardon me?
Joe, I think you froze there for a second. Could you repeat what you just said?
Oh, you're right. It's telling me I'm unstable, so I will try to behave. So the board did indeed put what we are referring to as a Johnson County plan in place effective last Thursday, which is set to expire, if you will, on the 11th. I would not be surprised if the board considered on the 11th look at the data and consider if some additional action is needed, or to let it expire, which, as you described, Sean, would be the I guess just an automatically, I guess, would default to, if that's not in place, then nothing is, and we are, it's more of an open situation, a level 4, if you will. But it is certainly possible that the board will take it up, look at the data, and make some determination to extend, or a conscious decision rather than just allow it to expire.
Hey, thank you, Joe. Thanks for that clarification. And he's absolutely right. The board can look at the numbers and extend their stage 3 further. And again, Joe, correct me if I'm wrong, they've been tending to do that on 2-week increments, and then coming back and looking at the data. And Joe, did you have another thing that you wanted to share with the library board?
No, sir.
Okay, thank you. Okay, before we go to a vote, are there any other issues that you want to discuss as a board?
Okay, then I would need a motion. There's a proposed on our briefing sheet there.
I move the Library Board of Directors approve the opening of all Johnson County Library buildings to the public on June 15th, 2020.
Second.
Any more discussion? All in favor?
Aye.
Aye.
Opposed? Motion granted.
Good, thank you. And so the next discussion point was the issue that Bethany had brought up, which was, did you guys want to make give direction to the library as far as the quarantining, or doing away with that practice? I think that would be helpful to get a direction from you as we begin to ramp up and open up our facilities.
I don't know how much good the quarantine is doing, so I would be comfortable with moving towards that being done. But I would like to hear what other people's views are, what our appetite for risk is. I think at this point, I feel fairly confident that empirically we're not seeing germ transfer via objects. That in the last 2 months, I've done shopping, food, things, and I don't know any, I just am not seeing that the caution is warranted. And so I would like to see us moved to that, but I'm not the only voice. So what do you guys think about the situation?
I can give you some information on the grocery. Just so 10,000 grocery workers have got infected nationwide, which sounds like a lot, but when you think of the size of our country, it's statistically small. Of that, I think you've got, I believe, 61 deaths from what I can remember of that statistic when I looked it up. But I know that the infection rate was around 10,000 in grocery stores. It's not a large number, and if you think about from the beginning and all the others, that's probably not unreasonable, as they may have caught it at the grocery store, it may be through community contact.
Sean, this is Janae Hanslick, and I just wanted to make a comment just for consideration, because I've heard from a lot of our senior folks in Johnson County, and of course they love coming to the library, but I've heard concern about, is it going to be safe for me as a vulnerable person to come to the library? So something to think about, maybe regardless of whether COVID can or cannot be transmitted on books, perhaps also thinking about what is going to help patrons feel comfortable coming back. So I would just put that out there as something to consider, in addition to the other conversation. But what's going to help especially our vulnerable senior citizens feel comfortable coming back to the library. So thank you.
Thank you, Commissioner. It's a really good point.
Yeah, that's a good point, because I mean, I feel 100% comfortable, but, you know, doesn't mean everybody is. What's the timeline of when a book is returned to the first person on the staff that touches it? And the first person as far as a patron would touch it?
So 72 hours is the time frame, so we don't get a physical touch.
And I mean, in normal situations, if we went to get rid of the quarantine.
The quickest it could be, you know, is within the hour, less than an hour. A patron is sorting. It's there, either those bins are filled and then it's going to a fine sort, which is on a book cart, and then that book cart's going out to the shelf. So that generally will happen.
But they could use gloves, and that would prevent them from even possibly getting it, the staff, right?
This is something we looked at and we talked to health officials. Their recommendation is actually using gloves is a greater health hazard, and are suggesting that staff, or recommending that staff wouldn't use gloves, and that we would provide them with hand sanitizers or hand washing. They're also, the county is at this point not providing staff with any PPE, so we are having our volunteers make masks. We are recommending that staff wear masks, but not requiring it. And again, from our Dr. Ariola, the Director of Health and Environment for Johnson County, is saying that masks don't offer no preventative measure for you, and may in some ways cause you additional problems. So there's not a lot of advocacy from our medical experts on that topic. The mask wearing prevents, if you're infected, from infecting someone else, and that's primarily what we would be looking at for why staff would be wearing, protect other staff members and to protect the public.
So can I ask a clarification question? So if, I'm sorry, this is Wayne. I guess my question will come down to this. From my understanding, the staff still can choose whether they're going to come back or not. Yep. Is that correct?
That's true.
So if we go out of the quarantine, they can still make the choice whether they come back or not.
Yep.
And that will dictate us. And then people in the community, if they don't feel safe, they can still make the decision whether they come back or not, correct?
Yeah, so what we're trying to do is, as soon as we get through the opening, we will be then going to offer curbside service. So originally we had flipped it the other way, and we were offering curbside service at all locations before we reopened. But this accelerated schedule means that we're flicking and that we're actually going to open. Not all our locations have drive-through, so we'll continue to offer drive-through. Once we're open, we'll be moving to offer car-size service at all locations. So if a person did not feel comfortable coming into location, and say it was a DeSoto or Spring Hill, that they could use that in the library and would go out and either put that in the trunk or the back seat of their car. And that way they could get the material, but they wouldn't have to come into the building to do it.
When you put something on hold, what's the time frame you have to pick up your book?
You have a couple of things. If the book is not on hold and it's just readily available, I believe, and correct me if I'm wrong, Jen, I believe it's 3 days, and then that book is then returned back to the shelf. Is that correct?
You have 10 days to pick it up once it gets, I'm sorry, it might be less than that. Nancy, is it 7 now?
So it's still at 10 currently.
Okay.
So once you have been notified, you have 10 days to stop by and pick up that item.
So a patron could basically self-quarantine by putting it on hold, wait 3 days to pick it up.
Yeah.
And then come pick it up in 3 days on a curbside, never come in. They've made the decision to quarantine without us making the decision to quarantine.
Yep. They could quarantine that piece of material. Are there other questions surrounding this?
Do you want us to vote on this, Sean, or do you just want guidance?
I think you're as a board, you're going to have to act and take a vote on it, and then I'm going to have to then act on that point.
Okay, then I propose that we end the materials quarantine and go back to our traditional method of materials distribution. By opening, by the 15th.
So on June 15th, we will be going. So just a clarifying question, if it's done immediately, then our staff would be directed to not be quarantining material that's coming in and the material. So we have a significant amount of material that is in-house. And if you're going to make that decision, I would propose that you would do it immediately to allow our staff to get that material.
Immediately.
Okay.
Okay, then immediately, effective immediately. Is that clear enough for the records, Michaela? Or do you want me to reiterate?
Second.
Good.
Second.
That was Dr. Burke who seconded. Is there any more discussion on that? Any concerns, questions?
I think you just communicate that, you know, we feel that it doesn't get transmitted and you can self-quarantine by waiting 3 days to pick it up. But
Okay, if there's no more discussion, all in favor?
Aye.
Aye.
All opposed? Motion carries. Is there anything else we need to talk about, or?
I think we're just looking for you to adjourn at this point.
All right, a motion to adjourn? Anybody?
Before I say that, hey, Amy, thank you for bringing us together and having us do this. So thank you. And so I move to adjourn.
Second.
All in favor?
Aye.
Aye.
Opposed? Motion carries. That's ended.